Hello. Now we're on chapter 9, micro lecture number 3, and we're going to be looking at joints, but in this we're going to be looking at movements. If you can kind of follow along every single movement that we do in this lecture, you will understand the muscles, you will understand the joints, and you might even take some of this information and use it in your real world life. So let's get started. So all of these are just going to be the movements that we do every single day. It's important to kind of know these movements, and for some of you, making a note card that says flexion, extension, hyperextension, circumduction, rotation, medial, lateral, all this stuff further down the line is the best way for some of you to memorize it. But some of you might work out. Some of you might have been athletes at some point in your life. So standing up in front of a mirror and going flexion, saying it out loud, and then you move an arm or a leg, and what you do is you decrease an angle from a straight line to a right angle. Anytime you decrease an angle, you're flexing. Every time you extend or increase an angle, you extend a muscle. This is important because a lot of students have difficulties with the muscles. It's not because they don't know where they are, they can't memorize it. They don't memorize all the extra stuff that are involved with muscles. Action for a muscle is very important. So if I move this arm down, all I do is I extend the arm. And if you think, all the ones on the back of the arm are extensors, all the ones on the front are going to be flexors, because flexors are going to decrease an angle. So all of them are going to be on the front, all the extensors will be on the back. And once you kind of stand up, stand in front of a mirror, and do these type of actions, this will be a much easier lecture for you to fully understand. And hyperextension is anything that goes beyond 180 degrees. So if this is a straight line, you go above 180 degrees, it's now hyperextension. So let's look at all the rest of the actions we have, or movements we have for this lecture. We can have flexion of the shoulder, where we decrease an angle. We can have hyperextension. You can also have it on the hip, the knee, and the leg. So the hip can flex because if this is a 180-degree angle, you bring your knee up, you flex the hip. You bring it down, you extend the leg. So also when you're thinking about it, it's not just the arms, legs, hips, and shoulders. This one, abduction and adduction. Abduction is away from the body, adduction is towards the body. The easiest way to memorize this is if you're in a mall, you're babysitting a small child, and somebody comes and kidnaps them, what happens to them? They get abducted. Abduction is always away. So abduction for a movement is going to be away, just like if somebody kidnaps your kid, they abduct you. Similar here, away from the body is abduction. Adduction is towards the body. You can also have elevation. Elevation is up, depression is down. This can be in the jaw, this can be in the shoulder region. You can also have protraction and retraction. Protraction is forward, protraction is back, or anterior and posterior. This also can happen in the jaw. You'll see that a lot with chewing. Circumduction is moving anything in a circular rotation. Also, if you kind of think, sequence of flexion, abduction, extension, and adduction movement, it's a baseball player winding up for a pitch. So sometimes you're using a bunch of different actions or movements for one skill. You can also have rotation. Rotation can be medial towards the midline or lateral away from the midline. Supination is going to put you in anatomical position where palms are up. Pronation is going to be palms down. To make it easier on you, you have a supinator and a pronator, and all they do is the supinator, make sure your palms are up. Pronator teres is going to pronate, or palms down. You can also have flexion and extension for the head and trunk. where you can move your head, flex and extend. You can do your shoulders, you can do your hips, you can do lateral flexion. You can do a lot of different types of movements with this. We're not looking at all these as a kinesthesiologist or somebody who's getting into coaching or movement. We're looking at this as how do these relate to the muscles that you're memorizing. You can also have special movements of the head and trunk, where you can rotate it left, rotate it right, the trunk and the head. You can also have protraction, retraction, lateral excursion, and then medial, and these are all going to be just movement of the jaw, which I talked about before. Also, the hand. The hand, you might not even think about this, but you have so many different types of movements with the hands because you have so many different muscles. If you think about it, you have 3 muscles right there, 3 more muscles right there, and 3 more muscles up there. They allow you to radial flexion towards the radius bone, ulnar flexion towards the ulnar. You can abduct the fingers, which make them open. You can have palmar abduction, which is moving the thumb away. And then you can also have opposition of the thumb, which makes it the opposable thumb, which allows you to grasp hold of things. And these, the abduction of the fingers, spread them apart. Adduction of the fingers, bring them back together. And these are just some ways for us to use all of those different muscles of our hands, and they're very, very, very important. And we've kind of went over all these too, the radial abduction, palmar abduction, and these are towards the palm, towards the radius, adduction away from, opposable thumb, and then reposition returns the thumb to 0 position. So many different special movements of the hand, but none of them are in red, so they're not going to show up on your test. But if you do get into physical therapy, you do get into other types of therapy for patients going through stroke or elderly patients trying to recover from an illness or an injury, these are very, very important because you have to think, you have to know what movements people can do in their hands so they can hold things, they can grasp things, they can make sure they don't fall down, they can take care of themselves. And if people take care of themselves, they're more likely to have a better way of life, and they're going to be more happy with their surroundings. To finish off, the foot. You have dorsal flexion. Dorsal flexion is going to be moving the toes up. Plantar flexion, moving the toes down. You can also have inversion. Inversion is rolling the ankle inward. Eversion is rolling the ankle outwards. This might not even seem like much with dorsal flexion, plantar flexion, inversion, and eversion, but because this is the furthest away from your brain, which you should know this by now, but if you're thinking about this, if you took a pen or a metal a metal rod, and you roll it on the bottom of your foot, your natural reflex is going to be to dorsal flex or move the toes away from that stimulus. In some brain injuries, when you do that, it actually plantar flex. So it's a really easy diagnostic tool, which you'll see in shows like Grey's Anatomy or in the hospital. If you're working in the hospital, you'll see these little things that doctors and nurses can do so they don't have to go into an MRI. They don't have to do this. They don't have to do that. They can just do these simple things with movements to see what injuries they have. And if somebody has a shoulder injury, go over all those individual movements that somebody has in a shoulder and see if they have any injuries for that. And then we already went over this inversion. You can also supinate and pronate the foot, but those are going to be a combination of plantar, inversion, and abduction, which we don't really get into. But go over these movements, make a note card or say them in front of the mirror, and you'll be much happier because you'll get all of these questions right on the test. Good luck.